Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a great guest on, Pat Dunn. He is a program manager at the American Heart Association. Specifically, Pat works in the Connected Health Center of Health Technology and Innovation. Pat, welcome to the program.
Great. Thanks, Tom. Glad to be on the show.
Awesome. I'm glad you took the time to join us for sure. The American Heart Association is doing some innovative things in many areas. The area that we're going to focus on today is around the content and the programs that they are publishing and the importance of that in the delivery of care model, more so now than ever before, as we try to find ways to engage patients and change their behaviors towards ensuring a better path to wellness. Not all about a script, not all about a medical device, not about remote patient monitoring or virtual care. It's about how this content sees the patient, or how the patient sees the content, in order for them to engage it and move themselves along the path of greater awareness, greater education, and with that comes greater outcomes, in my view. Your thoughts on that?
Yeah, absolutely. So our Center for Health Technology and Innovation was created in 2016, about 6 years ago, by our CEO, Nancy Brown, as really a connector between the tech world and the clinical and scientific world. And the key there is we want to help the tech world fulfill a basic promise that technology can improve health and achieve better health outcomes. And we believe, to your point, that content is a critical factor there. So knowledge is power, and so people really have a hard time achieving behavior change without knowing and understanding and trusting what they do. This goes all the way back. We used to, and we still do, we publish cookbooks. You can buy an American Heart Association cookbook in a bookstore. We publish brochures. You could pick a brochure rack, at your doctor's office. Eventually, we added, DVDs and CD-ROMs to those. Then we created our heart.org website. You could go to the website and find virtually anything you wanted to find. What we're doing is really that next innovative method for how we disseminate our American Heart Association science to the public. So what we've done is we've created a content management system of digital artifacts, both content and assessments, combined together in what we call care plans. They're really patient and user flow journeys. How do I manage my heart condition, whether it be my blood pressure, my heart failure, if I'm in cardiac rehab, even programs like diabetes and obesity. So the content is a critical component of that, how we deliver that. And we have to be innovative with how we deliver content, just like we have to be innovative in other aspects of what we do. So it's not just, a blog post. It's not just a video or a message. It's really a combination of those things put into really a multimedia platform and really designed for different types of users. There's some people that are not very engaged, hard to motivate. So we have content and plans designed for those types of users. There's, on the other end of the spectrum, there's people who are very motivated and want a lot of information, and they want it pretty fast. So we have, we're all with trying to achieve the same outcome, but with different methods of how we deliver that content. And we also have to do it in a way that's engaging. What's engaging for one person, some people like to watch videos, some people like to read articles. Some people really learn more from interactive types of things, doing assessments. And a critical part of that too is creating two-way communication between the patient and their healthcare professional. And that can be both synchronous communication, like a video call, but it can also be asynchronous, even messaging back and forth, so that the person gets the feedback that they need.
It's interesting. With the models, delivery of care models today, extending out beyond the brick and mortar, the engagement becomes all too important in my view. My audience has often heard me use the analogy of, the average Medicare patient with 5 chronic conditions sees 9 different doctors. CMS data says that they're only in front of those 9 doctors 15 hours in a given year. So these are, very sick and challenging individuals in the context of wellness with 5 chronic conditions. So the question is, what happens the other 8,745 hours, right? So it's not about getting a script and going to the pharmacy and after your doctor's visit and think you're going to be okay for the next 6 months or the next 3 months when you got your next follow-up appointment. It's really, how do we engage that patient outside of the office? So what homework assignment do they do? They might have a homework assignment to go pick up the script, but in a remote patient monitoring or patient portal or a combination of both, what is part of their clinical care plan that they can have easy access to? And I think you would agree that it's not just about reading a document or watching one video, right? It's about a series of that, inclusive of assessments, to measure, monitor that patient as they move along that empowerment zone. You noted information is power, and I absolutely agree. I often talk about awareness to wellness. So the more they learn, the greater the awareness. Hopefully that translates into different behaviors, which ultimately translates into that patient walking down the path to wellness, right? So it's really critical. We often talk about technology, and hence one of the reasons why I wanted you on the program today. We often talk about technology, adopt this, adopt that, right? Apps and all that good stuff. But the fundamentals here haven't changed, in the meaning of, how do we continuously educate the patient or give them at least access to the tools that they can be continuously educated. One might argue as a lifelong learner, but so it just becomes an absolute essential in a virtual care setting. Your thoughts?
Yeah. So first of all, heart disease is a relentlessly progressive disease. It's not going to go away. It's going to be something you're going to deal with for the rest of your life. So it's not something that's a quick fix. And it also involves a high level of patient involvement. So it's really more than, wearing a cast or taking a pill. Medication is very important, but the other non-medication related things that you do, the other things you put in your mouth, your food, your level of physical activity, how you manage your stress and emotions, the ability to achieve an ideal weight and avoid toxic behaviors like tobacco, alcohol, and other things that are not good for your heart. All of those things are critically important, and I would say they're as important as just simply taking your medications. So that's why the content and the information is so important, because people need to understand why they're doing what they're doing. The old days of just following a doctor's advice, we're long past that. People are coming to the doctor very well informed about the information. The challenge is there's so much information out there, it's really hard to know what to trust. So that's really where we come in to really help.
What do you mean? Not everything on the internet is true?
No, I don't think so. So it's a huge problem, whether it's a pandemic or whether it's a sub-pandemic like heart disease or even a pandemic of mental health, is people need to know what to do, and they need to know who to trust.
Yeah, and quite frankly, in the context of a pandemic, you don't always have access to your healthcare. And there's still challenges of access nonetheless. But in the pandemic world, it was close the doors, nobody's coming in, you can't sit in a waiting room. And if you did, it was one at a time. Otherwise, the waiting room was out in the parking lot, right? So but these virtual tools where this content is integrated becomes even more important. But you hit on the heart condition. Certainly, it's the American Heart Association
Mhm.
but there's with often heart disease there are many comorbidities, right? So your content reaches out beyond that to
Yeah.
touch across those clinical conditions. Can you
Yeah,
say more about that?
yeah, absolutely. So this goes back well over a decade. We actually had to define what that even meant. So we originally came up with Life's Simple Seven. It's now Life's Essential Eight. So these are 8 factors that really are designed to improve not only heart health, but just your overall quality of life. So what are those 8? It's physical activity, nutrition, achieving an ideal weight, avoiding tobacco, getting enough sleep, maintaining a good blood pressure, cholesterol, and glucose. So those 8 factors overall are what
Pressure, glucose, and
and
what
cholesterol.
and cholesterol.
Yep. So there's
Okay.
four things that you measure, and there are 4 behaviors that you do. So activity, nutrition, avoiding tobacco, and getting better sleep. And then there's weight, blood pressure, cholesterol, and glucose. And now, if you think about it, those 8 factors expand well beyond heart disease. They're also good for diabetes control. They're good for cancer prevention, and they're good for just overall health and well-being.
So 3 of those 4 that I can measure, weight, diabetes, and blood pressure. How effective and how without taking a lab test to measure my cholesterol? How do folks go about doing that on a
Yeah,
necessary
we
basis?
actually have a tool. It's in our system, but it's called My Life Check, and so you literally can answer those questions. The hardest questions to answer are your nutrition questions. The other things you can get your lab drawn for your cholesterol and your glucose. You can have somebody take your blood pressure, or you can do a connected device that'll measure it for you. Most people have a fairly good understanding of how well they sleep and how active they are. The nutrition can get a little tricky. So, but yeah, you can answer those questions, and it's all about. It's not just avoiding the bad stuff; it's also understanding the good stuff. So, fruits and vegetables, whole grains. Getting good high quality fats, not just not the grease, but good monounsaturated fats, getting plenty of fiber in your diet, avoiding sweetened beverages, but still have maintaining good hydration through water intake. All of those things are critically important, and those things cross over into your blood pressure for with sodium, into your glucose with carbohydrates, into your cholesterol with fats. So all of those things are highly interrelated.
Interesting. So the when you talked about eating fruits and vegetables, it's also being on a diet myself is really the time of day
Yeah.
in which you eat that too, right? It's so some of the guidance that I have is eating fruits and vegetables is good. There are some that are not so good for you, but that's important to know as well.
Yep.
But actually, eating them at 11 o'clock at night isn't so good either. So because the body needs the opportunity to burn some of that off.
Yeah, and that relates back to sleep. We're really much better understanding the importance of sleep. And so yes, so going into that nighttime, so if you're binge eating in the evening, that's not good. But on the other hand, your body does need essential nutrients so that it can recharge and rebuild while you're sleeping. So just trying to avoid everything is also not a good idea.
Yeah, avoiding things isn't my problem, but that's another story.
Yep.
So seriously, so how do I go about how do the listeners go about learning more about what the American Heart Association is doing in the area of content development, program development, care plan development? Can you tell us a little bit more about that aspect?
Yeah, so we have a what we call an innovators network. It's a network of companies that we work with directly, and they actually integrate this content into their solutions. So instead of having to buy our cookbooks or go into our websites, we've created this system where we can deliver these content and care plans via an API, which means, kind of server to server, business to business, B2B to these companies. And then they can actually build this content right into their solutions. Who are these companies? We actually have them listed on our website. Our website is ahahealthtech.org. You can see a list of the companies. You can also see the list of our science advisors that help us, build these content and these care plans. So that's really the best way to do that. We're hoping that eventually everybody that's building a digital product will want to use either the stuff that we've created or stuff that's aligned with our science in that way.
So certainly, having been in the EHR world, having content embedded into the EHR, but as you know, with innovation and the transformation of delivery of care, telehealth, remote patient monitoring, chronic care management are very significant new constructs that are currently rolling out. So to the listeners out there, if it's not just about remote patient monitoring or telehealth, you got to look under the hood a bit to see how else that platform can inspire patients and first off, how the health system can leverage some of the underlying elements of a platform, but ultimately this is about inspiring patients along their journey. Because if you're going to ask them to participate in a remote patient monitoring program, take your vitals, right? That's the easy part. That's 99454. But there's the element of there's purpose to remote patient monitoring, and it's that purpose that I think American Heart Association does an excellent job in nailing in that in the ability to provide really rich content, and not just about the heart. To your point about diabetes and those comorbidities and social determinants, because they all roll up into one, and that really is what inspired me to actually invite you on to be a guest, because I think those are important constructs that people may not look at, because sometimes it's the IT department that's looking for a platform. Your thoughts?
Yeah, well, and even when you mentioned remote patient monitoring, so we fully embrace doing remote patient monitoring. Those are data points to help you, to give you feedback. But to your point, if you're just taking blood pressure readings for the sake of taking blood pressure readings, then you're really kind of missing the point. The person should be getting that feedback, and it should be then, informing them of maybe some behaviors. Oh, my blood pressure is a little bit high today. I should take my medication. Maybe I should avoid, my really high sodium meal that I have planned. Or my blood sugar is high. I need to make a correction. My weight's been up a little bit. So the remote patient monitoring coupled with the behaviors, and that is where the content comes in, because it can help the person. Okay, my blood pressure is high. What do I do now? Do I dial 911? Do I call my doctor? Do I take more meds? Do I just ignore it and hope it goes away? And what do I do in the long term? How do I get my blood pressure under better control? And so that's where, do I lower my sodium? Do I cut back on my calories? Do I start a meditation program? So again, that's where we can help you figure out what you need to do to achieve those goals that are going to work for you.
Yeah, and that is ultimately the other leg that I think the delivery care models need to focus on. We often, go on the internet, and I would agree, not all the content is true on the internet, but so the idea of a remote patient monitoring program or a vendor promoting, hey, we can make you more money, Mr. or Mrs. Physician, but that is true. However, can we get you to wellness? Can we help you get your patients to wellness?
Yeah.
I often look at these new innovative approaches, such as telehealth, remote patient monitoring, chronic care management, remote therapeutic monitoring, as they're all fee for service type of events, but I can get you to value with the adoption of these platforms, but the incorporation of these programs is most significant, because then I can help. I have to move you, the patient, along this continuum in order to maximize the overall success. So I get what ACOs are doing and why that is. However, I can create a value proposition and a fee-for-service model that ultimately achieves the same end. I often talk about needing to redefine what value is.
Mm-hmm.
Value isn't always about taking risk. Value is about achieving outcomes, however you can get it, right?
That's right.
You can be incented by risk, or you can be incented by money, if you will. But at the same time, either one of those programs have to be able to focus on the patient, which is at the center of all this, right? Not my pocketbook. And so that's where, again, that's content. I can give you a blood pressure cuff all day. Take it 10,000 times a day. It doesn't matter, if you will. It matters of what actions you take because of what you learned by that blood pressure and by your new learnings of this content. Thoughts?
And that feedback is not only at the individual patient level, it can also be at the provider and the system level. So the doctor or the healthcare providers should also be getting that feedback from the remote monitoring. How well am I doing? What percent of my patients are at goal? And what can I be doing better to be getting better outcomes for my patient population? And really looking at who is it working for? So are there groups of my patients that are doing really well compared to other groups? And what is it about some of these other groups? We talk about social determinants. So is it the cost of medications? Is it access to healthy food? What is it that we can do to make, the overall population healthier? Because we're ultimately all paying for this bad health that we're part of right now.
Yeah. You hit on a sore point of mine, and that is one of the things that I believe we're challenged with. I still think that there's challenges in the access to care, but I think that there's greater challenges in the access to a cure. And when you said access to healthy foods, it triggered that thought for me. And because I think a lot of patients, the stats as well, they go to they go to the doctor, they go get the tests, they get the diagnosis, they get the script, and most don't fill. Right. So why is that? And I so not only don't they fill, we've had some previous guests on that says, the grocery store down the end of the street has, 65 different cans of beer and potato chips and pretzels, but they don't have apples and oranges. Right. And they don't have lettuce or tomatoes. Right.
Exactly.
So it's the ecosystem that matters. Right. I can be incented, but I could easily be disincented because my surroundings are not supportive. And I think that this is where the mindset of the U.S. and the American government, the U.S., the federal government, state governments, local governments, and even store owners need to be cognizant. If we're going to change healthcare, we have to do it together.
Absolutely agree. When you mention access too, another factor is people who live in rural areas frequently don't have access to healthcare. In many cases, they don't have access to these healthy choices that we just mentioned. And that's also where, digital technology can really come in and really help level the playing field, provide people with access to care through telemedicine, through remote patient monitoring. We mentioned the pandemic, and even before the pandemic, these access problems existed. And, there's a huge potential for really, really leveling the playing field across the board for these things. Of course, we have, people have to have access to the technology, just like they need access to healthcare and to food. But I think those things are very achievable.
Yeah, I do as well. I appreciate you saying that. And I think the challenge here is that we, as much as technology is being inserted into the delivery of care models, my personal opinion is that overall there needs to be a better integrated state in order for the true outcomes to be adhered to. But I still think that we're operating in a very disconnected healthcare model.
Well, and that's again where the content comes in, because you can have amazing technology. You can also have great science. But again, if people aren't using it, if they're not accessing the information, if they're not making those behavior changes, then it's really a lost opportunity.
Yes. So we're going to leave it there. Any closing words before we separate here?
I don't think so. I think we've covered a lot of good stuff. I think, again, our goal is really to improve the use of technology, that it can really achieve that basic promise that technology can be used to improve health and achieve better health outcomes. And frankly, for everybody, not just for people that can afford expensive gadgets, but really for the entire population, and not only the population in the U.S., but really, frankly, around the globe.
Very good. Pat Dunn, I appreciate your time. Appreciate your insights. And for the audience, Pat Dunn, Program Director at the American Heart Association, Connected Health, the Center of Health Technology and Innovation. Once again, thank you.
Great. Thank you, Tom.
I want to thank the show sponsors, HP. HP Engage Long Lifecycle Products provides the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, GenieMD, providing a modular, scalable, and customizable virtual care platform and clinical services to help providers extend care into the home, increasing access and quality while driving new revenue opportunities. If you missed part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern, throughout the week, and be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.